Hi, I'm Margaret. I live in St. Louis and I have a pre-existing condition. At the beginning of January of 2016, my New Year's resolution of healthy lifestyle and fitness was brought abruptly short when I did a breast exam and I found a lump. Turned out it was cancer. I had caught it at an early time, which I was extremely grateful for. As I pondered that diagnosis, I was more worried initially about whether I had the insurance to cover it and how I was going to handle this. And it was of a concern because I'm a sole practitioner. I work for myself. I have a nice business. And as it turned out, my insurance was very good, and it covered the things I needed. My mother was very glad about that because she called me. She was afraid that I would skimp and try and not get certain treatments because of the cost or that insurance wouldn't cover it. And I felt good then, I feel good now that I was able to reassure her really as my mom, that I was going to do everything I possibly could to get the treatment that would give me the best possible outcomes. But when you're going through something like this, I gained a great deal of strength by the support system of friends, family, and people I thought I just knew as acquaintances, finding out about my situation, offering to help, checking in, sending me words of encouragement, calling, and things like that. And, and all of this was as welcome, if not more, obviously more, but it was welcome. I didn't have to worry about the insurance piece. And today I don't have to worry about whether or not I'm going to get covered. All in all, I wouldn't recommend this experience to anybody. Far from it. But thanks to the support of friends and family, thanks to the assurance and frankly service of insurance and an outstanding healthcare team, I'm pleased to report, knock wood, I'm doing well and I've made a full recovery. And that's why I have to say, I have scratched my head over the last 18 months, not only at what's going on in Washington, but what our own state attorney general, whose salary I help pay, is trying to do by essentially gutting the pre-existing conditions as they exist today for me and millions of Missourians like me, my neighbors, people I know, people I don't know. Because in my mind, I had a health care plan, I have a health care plan, and it's based on not only the treatment that I received, but the follow-up care and screenings that I need to get going forward. And I'm 54, so I don't know what else lies ahead, big cancer aside from that. And I have a plan for that. I can cover that. But when that gets thrown up in the air and thrown to the courts to make what I think is and no pun intended, a cheap political point, and to show allegiance to one side or the other, I think we're losing sight of what the state of Missouri, what the city of St. Louis, what our communities are all about, and it's our friends and neighbors and our families. And sometimes we need help. Sometimes we don't have the ability to do what I was able to do. With Claire McCaskill, doesn't mean I've always loved everything she's done either, but with Claire McCaskill, I think we as Missourians have a better shot at getting a fair, equitable, and reasonable plan that not only covers people like me, but also people not like me in outstate Missouri, or Missouri, whichever the case may be. I mean, we are of one, and I really want to see policy pursued that way, and I think we have the best shot with Senator McCaskill. She's done it with veterans. She's doing it with the opioid crisis. She's outspoken. And as I said before, sometimes I always don't like what she says, but she's principled.